Hello, I'm Dr. Mark Pearson, a consultant psychiatrist in psychotherapy working in Birmingham in England. We've talked so far a bit about the idea of there being a dynamic unconscious, that things that people are unaware of may actively influence them and produce symptoms. We've talked a little bit about the types of things, the places where you may look to try and find out what these things are. And I'd like to talk today about how they may be affecting you in your current life and what you might do about them. Exploratory therapy is actually very good about helping you explore and discover things, but it's not always so good about telling you what you might do. In terms of symptoms, the most common symptoms people complain about are anxieties, particularly anxieties that seem irrational to them. So I'm not really here talking about fear of spiders and snakes and things which are really could be quite dangerous to you, but irrational fears about contamination or things which most normal people would manage without too much trouble. Fear of being shut in narrow spaces, fear of flying. So they're phobias which are a bit unusual. You might also be suffering from depression, which could be a sense that life is futile and hopeless, and that there's nothing you can do about it. It's all outside your control. In terms of relationship disorders, and we talked about attachment theory last time, the sort of problems people would get into would be most noticeable in their intimate, long-term relationships with their partner and perhaps with their children. We've talked about two patterns of disordered attachment. In the one, people are very ambivalent and they're not sure whether they want a relationship or not. They may be clinging at times. They may be very fearful of abandonment, and they may be difficult to be with because the temporary separations which are necessary when people go to work or go abroad are to them major traumas, and they fear being left and abandoned permanently. So they may be constantly asking for reassurance from their partners. Do you love me? And this, of course, can be quite tedious and wearing because there's a way in which the other half feels, I just can't reassure him or her, and this just goes on and on. The second type of disordered attachment is called avoidant attachment, and I think here of people who are okay if they're in their sheds or doing their hobbies or at work, but when they come to be more intimately involved with people who want to talk with them, people who want to interact, they find that they're uncomfortable and they want to get away from the situation and just be on their own. And you can see that these things are problems not just for the person themselves, but for the people they're in relationship with. So I'd suggest that if you do think you have a disordered pattern of attachment, you talk to your partner, and this actually may be the beginning of therapy. There's no reason why you shouldn't look at what attachment theory, which is easily researched on the internet, and to try and think to yourself which type of attachment pattern you have, because once you understand each other and your difficulties, you're probably already becoming more sympathetic and realizing that these are things that have arisen in your early life and they may be quite beyond your control, although it is, of course, within your control to do something about it. Having said all that, I'd like to then give some thought to whether you can do your therapy on your own or with people that you're currently involved with in your current life. It's certainly worth a try, I think, because therapy is expensive and time-consuming, but there may be problems involved with this. And let's just think for a minute about these problems. If you're trying to analyse yourself, you may be trying to find out things which are deeply upsetting to you, and it may be really difficult for you to think about these things and to approach them without fear. So you may need to be with somebody that you trust. This can be a therapist who you see weekly on a regular basis and you build up a long-term relationship with them. It can be with a friend who you trust and who perhaps has some knowledge and understanding of this. and you can try to do it on your own, but I would suggest that people are not always going to be successful. If you are going to try and do things on your own, one good way to start is to try and record your dreams. There's a sense in which when we dream, we're thinking in an uncensored way, without the normal controls upon us. We're obviously paralysed in our sleep, so we can't actually take any action. And thoughts and feelings may occur to us which we wouldn't manage to have in our waking life. Some people say, well, I don't dream. And this is probably untrue, because when we put people in sleep laboratories and we notice the times when they have something called rapid eyeball movement, and if we wake them up at those times, people almost invariably do report dreams. So if you want to try and record your dreams, a good idea is to set your alarm clock a bit early, wake up with the tape recorder behind you and dictate straight away, because as you know, dreams disappear, they evaporate rather rapidly, and you can capture them by talking into your tape recorder. And then you're looking for recurrent themes, and particularly recurrent themes which are highly emotionally charged, which may give you some clue into what area you want to look into. And then, of course, having looked into it, you might think, well, what am I going to do about it? Now, I suggest when you think about what you want to do, that you don't think, I'm just going to carry on exploring this forever. If you have symptoms of anxiety, you might well need techniques to help you face up to things that are making you anxious. And they're not that difficult to find advice about this on the internet. The sort of things that you learn to control, things like your breathing and your muscle tension. You learn to relax and tense your muscles, and you're trying to develop a control of things which you can control. And then this makes it easier to face things which you find made you very fearful in the past. The techniques for dealing with depression are, I think, slightly less obvious, and people suggest that approaches such as being more compassionate and forgiving towards yourself, a sort of acceptance of your symptoms, which are sometimes called mindfulness, can be very helpful. Again, sometimes simply the act of sharing how you feel and continuing to explore with somebody why you feel like this may be helpful. Jung would suggest that you might consider joining something, a social group, something that helped you express your creativity and your spiritual longings, so that you don't try and undertake getting back on a good pathway and finding things that are meaningful to you just on your own, but you do it in a social context. There's sometimes said to be a competition between these techniques, which are said now to be cognitive behavioural techniques, and for which there's a better evidence base, and the type of exploratory therapies which I've suggested. But I don't think this needs to be the case, and having done some exploration, you might well embark on changing your thinking about these things, or changing your behaviours, and learning to control your anxiety as a way forward. Whether you engage a therapist or not is rather up to you. If you find you've tried these things and you don't get anywhere with them, and you're still fairly convinced that you have problems in your relationships, or you have fears and feelings which are outside your control, then you may want to go and see somebody who's professionally trained. The advantages of this are that the person is in a different sort of relationship with you. Friends may want to agree with you too quickly. They may want to placate you. They may want to reassure you. And these are some of the traps which therapists don't fall into. They tend to leave you a bit more space to explore things. They tend to keep the problem within your control rather than offering a reassurance or advice on what to do. And this may be quite helpful, because it's not necessarily the normal way that people react to each other. When we care about somebody, we often want to take the hurt and the pain away too quickly, and this interferes with our ability to listen and to help people find solutions of their own. Couple of things to be cautious about when you're seeking therapy. One is to find somebody that's properly professionally trained, that has an ethical code, that has a complaints procedure if things go wrong. Another is the problem of dependency. Once you start in therapy and you start to feel you benefit from it, you may be disinclined to end it, and this might be particularly true if you have an attachment disorder and you find separation is very anxiety-provoking and provokes fears of being abandoned. So I would urge you to consider with your therapist at the outset how long therapy is likely to last and how you might bring it to an end. Otherwise you might find it becomes interminable and extremely expensive. Having said all that, engaging a professional, and of course I am a professional, so I suppose I would say this, can be very helpful, and can be, if you think your problems are arising from things which you find very difficult and anxiety-provoking, it can be the best way to proceed.